Hi, everybody. Thank you, Richard and TCCY, for this opportunity to pre-record a presentation for you. I'm sorry I can't be there in person. My name is Sarah Loch, and I'm the Director of Research Operations at the Vanderbilt Center for Child Health Policy. I'm honored to be here to represent our team at this meeting and be able to share with you more about what we do at our center and hopefully provide some information that will be useful for you in the work that you're doing across the state. So my goals for this talk are twofold. First, I'm going to share about our center's mission and some of the work that we're doing. And then I'm going to dive into our rapid polling that we've been doing in Tennessee to understand parent views on child health in our state. So our mission at the Center for Child Health Policy is to improve the well-being of children and families through research to transform public policy. We are a nonpartisan research center, so we do not engage in advocacy work ourselves, but hope to be able to provide data on what is happening for children and their families, and for people to be able to use those data to provide evidence for data-driven changes to policies that will help improve outcomes for children and families, both nationally and in the state of Tennessee. So the ways that we are working towards achieving our mission are through our 4 pillars, the first of which is care transformation. And this is where we're focusing on conducting research that's going to inform data-driven changes to improve clinical care for children. The second focus is on public engagement. So we at the center firmly believe that the work that we're doing is going to be most impactful when we're able to engage a broad array of stakeholders. We know that children and families live in communities and engage in large systems of care every day, and we're striving to engage all of those people in the work that we're doing. Our third pillar is workforce development, and this is really all about providing guidance and training to the next generation of researchers that are going to be focused on working with children and families. And lastly, we focus on producing policy-relevant work at the center. I think this is what really sets us apart from some of the traditional academic approaches to research and work. We don't do work for the sake of doing work, and we don't do research for the sake of doing research. For every academic paper we publish, we work really closely with our government affairs office at VUMC, and they help us distribute policy memos to legislators, and we also work closely with our tremendous communications and dissemination teams that help us build out a release plan for all of our work, and that will include things like reaching out to traditional media sites as well as disseminating our infographics through our social media channels. So what makes our work possible really is our amazing staff and center membership. We have 7 full-time staff members along with about 25 affiliated faculty members from across the medical center and Vanderbilt University. The team has a wide array of expertise in everything from pediatrics to economics to public health and biostatistics, just to name a few. So the next thing I'd like to do is share some examples of the activities that our center does that help support our 4-pillar goals. So the first thing I'm going to talk to you about is some examples of our research and dissemination work. And then I'll give an example of a clinical program that we just started that's helping drive care transformation. And then lastly, we'll spend the most time digging into the poll work that we're doing to understand parental concerns about child health, both nationally and in Tennessee. So getting started with some examples of our research, I'm going to give you an overview on the next few slides about our research that has focused in on the opioid crisis as well as the child welfare system, and how we've been intentional about applying an equity lens into all of the work that we're doing. So the first research example I want to share with you is our work to understand the barriers women face when trying to access treatment for opioid use disorder, especially during pregnancy. So the reason we care about this is clinical trial evidence tells us that medications for opioid use disorder reduce relapse risk, overdose deaths, as well as lower the risk for preterm birth, and also that these medications are safe and effective for use during pregnancy. We obtained some funding from the National Institutes of Health where we conducted a study with trained secret shoppers who made calls to clinics and providers who offer this kind of treatment and recorded whether or not they were successful in obtaining an appointment. Each secret shopper was assigned a pregnancy status of either pregnant or not pregnant, an insurance status of public or private insurance, as well as a race ethnicity profile. And the calls were done in late 2019. So what we found from this was that pregnant callers had a harder time obtaining an appointment for treatment compared to rate varied a lot by state and insurance type. So for example, in the state of Kentucky, 48% of pregnant callers were able to obtain an appointment with a buprenorphine prescriber, and buprenorphine is one medication for opioid use disorder, versus 71% of non-pregnant callers. Compared to Virginia, where across the board, regardless of pregnancy status, about 65% of callers were successful in obtaining appointments. An example of the insurance difference was that in Tennessee, only 8% of callers who had Medicaid were able to obtain appointments with methadone providers. When you compared to in the state of Massachusetts, almost 90% of callers who had Medicaid were able to get appointments with methadone providers. We also obtained an equity supplement that's going to allow us to look at whether or not race and ethnicity played a role in whether or not callers were able to obtain appointments. So what we're doing with that is looking at the race of the caller and the racial makeup of the community in which the clinic was located, and seeing whether or not a disparity between those influenced the likelihood of obtaining an appointment. So another research focus for us has been to understand the impact of caregiver substance use on infants and the U.S. child welfare system. So particularly, we are focused on opioid and substance use during pregnancy and how that relates to infant foster care placements after delivery. So the reason we're interested in this is that the national data show us that rates of infants entering foster care is really outpacing any other age group. And cases where parental substance use is a factor in those placements is also increasing. When looking at these rates by state, we see a lot of variation. So our group is working to understand what could be driving those differences that we're seeing between states. And part of that is we're trying to understand how a lot of the recent policy changes, like for example, the change to the Child Abuse Prevention Treatment Act, a few years ago that started mandating plans of safe care for substance-affected infants and caregivers. And we want to understand how implementation of those federal policies at the state level is having an effect and maybe contributing to this variation. So to dive a little deeper, the next study we did was to look at differences in these rates at the county level. So we looked at rates of infant foster care placement, as well as rates of infants diagnosed with NOWS, or Neonatal Opioid Withdrawal Syndrome. And this is sometimes called NAS, or Neonatal Abstinence Syndrome. And it's a clinical diagnosis that's made after birth that some infants who are exposed to opioids or substances in utero will display. So at the county level, we found that NOWS was associated with infant foster care placement, but we also saw a lot of county-to-county variation within states. So if you look at the top set of maps of Kentucky, Tennessee, and North Carolina, you'll see that the darkest teal-colored counties are where we're seeing the highest rates of NOWS within these states. If you look at the bottom set of maps, the dark teal counties represent counties where we see the highest rates of infant foster care placement. So you see that high rates of NOWS and high rates of infant foster care, when you're looking at the county level within states, don't always overlap. So in our study, we did look at other characteristics of the counties that are related to infant foster care placement, and found that county rurality as well as adult employment rates in the states were related to rates of infant foster care placement. But these quantitative data don't really fully explain the differences that we could be seeing. So to help enhance our understanding of what could be driving these local differences, we're actually in the midst of doing a qualitative study right now where we're conducting interviews with state child welfare offices in a sample of states across the country. We're hoping to understand from them and their perspectives how local constraints as well as translation of policy into practice at the county level could be driving some of these differences that we see. We believe that hearing from the people who are doing the work on the ground will provide a lot of insight that the quantitative data just aren't able to provide us. And the reason that we're doing all of this is once we're able to understand more deeply what's happening at the county level, we're hopeful that this data will provide some evidence to for policy change, as well as maybe things like differences in resource allocation, just for an example, that'll help achieve more equitable outcomes within states. So switching gears to our clinical work, I want to share about our new Firefly program that we're doing in partnership with TennCare and the Tennessee State Managed Care Organizations. So our program Firefly is funded through the Center for Medicare and Medicaid Innovation's Maternal Opioid Misuse model, and it is a patient-centered service delivery model that aims to improve quality of care and reduce costs for pregnant and postpartum Medicaid beneficiaries with opioid use disorder and their infants. The model leverages a single site of care that integrates obstetric, addiction medicine, psychiatry, pediatric care, and social work for pregnant people and their infants from the prenatal period through discharge after delivery and up to 1 year postpartum. Additionally, the model leverages a team of peer recovery specialists that help provide support to the patient throughout their time in the model, as well as coordinate care, services, and support. The program is housed in the Center for Women's Health at Vanderbilt at the 100 Oaks campus in Nashville, and has enrolled 119 patients already since last summer when the program was launched. So lastly, I want to share more about the rapid polling that we're doing of parents to understand their concerns for child health. So our Vanderbilt Child Health Poll surveys a representative sample of parents to better understand what their concerns are regarding the health of their children. So starting in 2019, we've done 4 surveys to date. One was a national survey that we started in the first year of the pandemic, and our goal with that was to understand how COVID was impacting families. And then our other 3 surveys have been Tennessee-specific polls that were done in 2019, 2020, and 2021. So to complete these polls, we work with a company called Ipsos Public Affairs. Ipsos has an existing online platform that they use to collect poll responses from parents throughout the state. What they do is potential poll respondents will receive an email invitation to complete the poll online at their convenience. People who don't respond immediately will receive reminder emails to hopefully get them to participate before the fielding ends. There are some obvious limitations, I think, to doing online polling. Ipsos does try to overcome some of those by addressing internet concerns and also providing hardware to households who might not otherwise be able to participate. Overall, though, this online platform allows for rapid data collection that just isn't achievable when you do surveying by phone calls and also physically mailed questionnaires. So our goal is to do a poll in Tennessee at least once per year. And since we are doing recurring polling, we have certain topics that we try to keep consistent throughout the poll. So we'll be able to measure or at least recognize changes to markers in child health in Tennessee over time. Some of these recurring topics include top concerns for kids, health insurance coverage, as well as food security, education, mental and behavioral health, and also, since 2020, COVID-19. A lot of our focus turned to COVID-19 starting in 2020, as I'm sure is true for a lot of people. So we did add some COVID-specific questions to the poll to understand how it's impacting kids and their families. We'll probably continue to keep these questions on the poll, if not directly. We'll still always be looking at the results of our poll through the lens of COVID-19 to try to understand some of the lingering effects the pandemic itself and as well as restrictions have had on families. So as I've mentioned, one of the pillar goals of our center is to get our work into the hands of a broad audience. So I just wanted to, on this slide, highlight a few of the places where our poll work has ended up over the past few years to demonstrate the diversity of audiences we're able to reach. So this first example is actually from our national COVID poll, where we ended up publishing it in the journal Pediatrics. This is kind of more of where you'd assume an academic study would end up, but I just wanted to put this on here to demonstrate the rigor of the methods that we use for our polling is on par with what you'd expect in a peer-reviewed journal. The next one we were particularly excited about, so TCCY was actually able to leverage some of the findings from last year's poll in their State of the Child report from 2021. And we were really happy to see that. That's the reason why we put the data out there. We want people to be able to use it in their own work. And then we also have media and news outlets who report on our findings. So we've had statewide reporters, like in this example from the Tennessee Outlook, pick up our results, as well as some more regional news outlets, particularly this year when we've started reporting our results by Tennessee Grand Region. So now focusing in on our most recent Tennessee poll that was fielded this past fall from October 19th through November 28th, 2021. In this poll, we had over 1,000 Tennessee parents with at least one child under the age of 18 respond. And we scaled our results based on the 2019 American Community Survey by applying survey weights, and this helps us ensure that what we're reporting is representative of the population in Tennessee. We also had a new partnership this year. We were able to work pretty closely with the Parent Leadership Collaborative that's coordinated out of Nurture the Next. We were super grateful to be able to get input on the survey design process, decisions about the question topics, and input on how we release the materials through conversations with the parent leader group. And like I mentioned on the slide before, we also added sampling by Tennessee Grand Division this year. The parent leaders were actually very instrumental in our decision to do this because they expressed the importance of having more localized data when they're doing their advocacy work across the state. And lastly, a really big thank you to our poll funder, the Bodecker Foundation, that helped make this poll possible. So in this last part of my talk, I want to share a sample of the results from this year's poll. I'm only going to have time to present the overall state results, but I do encourage you afterwards, if you're interested, to check out our website where you can see all of our release materials, including our infographics that report by Tennessee Grand Division, as well as race and ethnicity. And I'll link our website on the last slide of this presentation. So one of the recurring questions we ask parents on the poll is what their top concerns are for kids in the state. We do this for two reasons. One, just to keep a pulse on what's important to parents, and it also helps us decide what kind of questions to ask on future polls. So top concerns for parents this year included education, school quality, bullying, including cyberbullying, and child mental health and suicide. And then also on the list were COVID-related concerns, including actually getting sick from COVID, but also disruptions to schooling due to COVID restrictions. And then since we've been doing this poll over the past 3 years, bullying, including cyberbullying, has been on this top 5 concerns list. So this year we actually added a new section to our poll where we dig a little deeper into this topic. So the next poll topic I want to highlight is about child food security in Tennessee. So while the numbers that we're reporting this year stayed pretty stable since last year, this is still a pretty big concern for Tennessee families. In this year's poll, 44% of parents responded that they had received some sort of nutritional support or food support in the week prior. But still we're seeing nearly 1 in 3 Tennessee parents reporting that their family experienced food insecurity at some level in 2021. We also asked parents this year how they felt about free school meals in Tennessee for children, and 90% of parents said that they were in favor of this. That is pretty astounding to have nearly universal support of any measure. So we think this provides some really strong evidence to support free school meal initiatives that are happening across the state because it's really what parents are wanting to see. The next poll topic I'm going to talk about are our results on child mental health. So this has definitely been a hot topic in the national news and something that I think a lot of parents and practitioners have been talking about. There were definitely concerns about this before, but since the pandemic started, our poll results indicate that the mental health of children in Tennessee continues to be a big concern for families. This year, 1 in 7 parents reported that their child was diagnosed with anxiety, which is up from 1 in 10 in 2019 before the pandemic started. Some other mental health diagnoses that topped the list that parents reported included 15% being diagnosed with ADHD and an 8% being diagnosed with depression. So we all know mental health care access can be a challenge, particularly during the pandemic for kids, because a lot of families rely on services through schools. So we also asked parents about their worries for undiagnosed conditions in their kids. The concern for undiagnosed anxiety this year was reported at 17%, which is an increase from 14% in 2019. And concerns for stress in kids increased from 10% in 2019 to 16% this year. I think we're all pretty well aware at this point how disruptive the pandemic has been for our lives, and the effect on kids, I think according to these poll results, can't be ignored. So another important topic related to mental well-being of kids that's also been in the news recently is screen time and cyberbullying. So overall, our poll results showed this year that the vast majority, 70% of Tennessee parents, are worried in some regard about the amount of time that their child is spending on screen time. And then while 2 in 3 parents report that they try to place limits on screen time, still nearly half of Tennessee kids are spending 2 or more hours on non-educational screen time every day. The second part of this release was about cyberbullying. So cyberbullying is also a huge concern for parents of school-age children. Nearly 3/4 of the parents surveyed reported that they were worried about cyberbullying, and about 1 in 10 parents report that their child had already been cyberbullied. Most parents reported to us that they found out about the cyberbullying because their child told them directly, but another way that they were finding out was by actively monitoring their child's devices. And parents report that the top places where the cyberbullying occurred were on social media platforms like Facebook, Instagram, TikTok, and Snapchat, as well as online video gaming platforms. So these results further emphasize the importance of being able to talk to children and addressing mental health concerns for children and adolescents. We know that technology can be really beneficial for the cognitive development of children for educational purposes, but I think it's all about trying to find a balance, particularly as our society continues to move towards greater reliance on screens and technology for our day-to-day lives. And it's clear from our poll results that this is something that Tennessee parents are also very well aware of and thinking about. So now moving on to some of the COVID-specific topics that we asked about on the poll. One of the top concerns for parents was learning loss during the pandemic. So before I talk about these results, it's important to remember that we polled parents in late fall 2021. So to think back to what was happening at the time, we didn't yet have the Omicron surge variant that happened around December 2021. So some of these metrics might have very different numbers at this point if we polled parents again. So in the fall 2021, on average, across the state, Tennessee kids had missed an average of 8 days of school due to COVID-related issues in the fall semester for reasons like quarantine, school closures, and illness itself. Over 70% of parents reported that they wished that there was some remote learning option for their child at school. We believe this would have been helpful to help combat some lost instructional time that occurred while kids had to be out due to quarantine or because the physical school space was closed. So next we asked parents about their views on vaccines for kids in terms of both the flu vaccine as well as the new COVID vaccines. Again, important to keep in mind the timing of the poll and what was going on at the time. So we didn't have the Omicron variant, and at this point, vaccines for kids ages 5 through 12 were not yet widely available. Actually, when we were fielding the poll is when the first emergency use authorization for that age group was approved by the FDA. So thinking about that time frame, in October and November 2021, at that point, 46% of parents reported that their child 12 and older was vaccinated for COVID, and another 14% said that they were likely to get the vaccine in the next few months. At about the same percentage of parents, 43%, said that they would likely get the COVID vaccine for their child under 12 when it became available. For parents that had not yet had their child vaccinated or were unlikely to get their child vaccinated, most of them were citing either trust in the vaccine, concerns about safety, or already having had COVID as reasons for not getting vaccinated. So then looking at the flu vaccine in comparison to COVID, over 60% of parents said that they would likely get the flu vaccine for the child this season. So we are seeing some differences in uptake of flu vaccine versus COVID vaccine. So those vaccine results transitions nicely to the last bit of the poll I wanted to share with you today. We were able to ask parents in general about their trust in vaccine information that they're receiving, and not just the COVID vaccines, and where they were likely to go to get information that they feel like they can trust about vaccines and COVID-related information, like about opening and closing schools. So since 2020, when we asked parents the same question, we saw a 10% decrease in the number of parents who report that they trust the information that they receive about shots. There's been a lot of concern in the pediatric provider community about trust in routine childhood vaccinations, and worry that that would erode since there's been so much contentious reporting on the COVID vaccine. Unfortunately, I think our poll results from this year really back up that worry and suggest that those concerns are not unfounded. However, on the flip side, Tennessee parents also reported this year a higher level of trust in their child's healthcare provider for trusted information. So we wanted to just emphasize that we feel like this is an opportunity for providers to be able to share accurate information about vaccines, so parents have all the information they need in order to make informed decisions about their child's care. Other top sources for trusted information that parents reported to us were both the Centers for Disease Control and Prevention as well as scientific studies. So that brings me to the end of the poll results that I wanted to share today and this presentation. We do have one more poll release that will come out in the coming weeks. I encourage you to look for that in the media, as well as check out our website at childpolicy.org/poll, and you'll be able to find all the materials from our past releases, including those infographics that look at results by region, as well as race and ethnicity, as well as a deeper dive into the methods that we use for polling, and the data tables as well. And then lastly, here's my contact information. You can email me at any time at sarah.loch@vumc.org. I also encourage you, if you have Twitter or Instagram, to follow our center on those platforms at VUMC Child Policy. Thank you so much. I hope you enjoy the rest of your time at Child Advocacy Days.